Discharge education after back surgery. St. Mary's Hospital is the right place to be when you have spine surgery. Since you won't be in the hospital for very long, we want to take every opportunity to be sure you have the tools and information you need to continue progress after you leave the hospital. After you review the basic information in this video, your nurse will provide specific instructions from your surgeon. So write down any questions that come to mind in order to be confident that you are equipped to leave the hospital safely when you are discharged. After you get settled in at home, you will need to call your surgeon's office to make your follow-up appointment. Your nurse will give you the time frame for scheduling that visit. Your surgeon will be prescribing pain medication for you to continue to take as needed at home. Sometimes the surgeon will provide a muscle relaxer if needed. It is very important to keep track of when you take any prescription medication. Start a log of all your medications, including when you take them, to ensure that you keep the correct time intervals. Your nurse will review the side effects to watch for with any new medications. Remember to contact your surgeon if you experience any side effects. If you would like to have your prescriptions filled before leaving the hospital, you may use our outpatient pharmacy, which is available Monday through Friday. For your convenience, your nurse can send the prescriptions to that pharmacy to be filled. When the order is ready for pickup, your coach can take the paper prescriptions to the pharmacy and pay any co-payment at that time. You may choose to pick up your prescriptions at your own pharmacy on the day you're discharged. If at home you are running low on opioid pain medications, contact your surgeon's office. Your pharmacy cannot refill them by phone. You will need a paper prescription from your surgeon's office. Discomfort is a normal part of recovery. Multimodal pain management allows for more effective pain control with fewer side effects by combining opioid pain medication and Tylenol along with ice and activity. Take pain medication as prescribed with meals or a snack and at least 8 ounces of water. Take pain medication before activity and at bedtime as needed. It can take up to 30 or 45 minutes from medications to decrease your pain. As you recover, decrease the amount or frequency of the pain medications. Notify your surgeon if the pain medication is causing side effects such as drowsiness, dizziness, upset stomach, or unrelieved constipation. Avoid alcohol during your recovery as it increases your risk of falling and it interacts with other medications you may be taking. Tylenol, taken regularly, is also effective at managing pain and minimizing the need for opioid pain medicine. There is a limit to the amount of Tylenol that is safe to take, no more than 4,000 milligrams in a 24-hour period. Stay away from any anti-inflammatory medications or aspirin unless specifically instructed by your surgeon. Ice packs can be helpful for pain relief and can be placed on or around your incision for 20 minutes at a time. Do not apply ice directly onto your skin. If the cold is uncomfortable, use an additional layer of cloth between your skin and the ice pack. Frequent walks can be helpful to decrease stiffness and manage pain. Throughout this presentation, we will refer to red, yellow, green zones to assist you with your recovery at home. In each zone, we discuss common symptoms and issues you may see and what to do about them. We will talk about the issues that are a normal part of your recovery, the green zone, symptoms that need to be discussed with your surgeon or primary care provider, the yellow zone, and symptoms that require immediate medical attention, or the red zone. After surgery, it's common to experience some degree of constipation. That is why we start right away to give you stool softeners in the hospital. When you go home, you need to continue to take stool softeners to manage constipation every day as long as you are taking opioid pain medicine. It is also important to increase your water intake add more fiber to your diet, and stay as active as possible. For some people, warm prune juice or hot coffee may be all that they need, but if you don't have a bowel movement by the third or fourth day after surgery, you can't ignore the problem. You may need an over-the-counter medication, for example, a fiber product like Miralax or even a Dulcolax suppository. Medications are not usually intended to be a long-term solution. As you become more active and are able to move away from the pain medicine which causes constipation, you need to focus on a healthy diet to maintain a good routine. Pay attention to the high-fiber foods such as whole wheat bread, bran, oatmeal. And don't forget fresh fruit and vegetables with at least 8 cups of water every day. Management of constipation is a normal part of the green zone after surgery. If you have a white cotton gauze dressing on your incision, it will need to be changed daily and possibly more than once a day until the drainage stops. Your nurse will show you how to change the dressing and provide you with the supplies for home. It is very important for you and your coach to wash your hands before changing that dressing. Yellow zone is a caution zone. Call your surgeon if the incision continues to drain, if the drainage has a foul odor, or the area around your incision is red, swollen, painful, or if you have a fever of 100 degrees or above that continues. Follow your surgeon's specific instructions about when you can shower. For most patients, that is 2 to 4 days after surgery or as soon as the drainage stops. Always take a shower when someone is at home who is able to help you. And take special care if pain medicine tends to make you a little lightheaded. You can leave the dressing in place while you shower and then remove it immediately afterwards. Let the area dry completely before applying a new dressing. Tub baths, pools, hot tubs are restricted until you are cleared by your surgeon. Back precautions are intended to protect you and to allow you to heal. That is why the BLTs are so important to remember. No bending, lifting, twisting, or sitting for long periods of time. Don't do any back exercises until you've been instructed by your surgeon. And definitely limit anything that you pick up to under 5 pounds. Other guidelines for a successful recovery include the use of a firm mattress. You may find a comfortable position on your back with a pillow underneath your knees or on your side with a pillow between your knees for good alignment. Limit the time of sitting to about 30 or 45 minutes at a time. In fact, changing positions every 30 to 45 minutes while awake is recommended, whether that is sitting or laying down. Walking is a good form of exercise as you recover, and increase the distance gradually as you balance rest and activity. Compression stockings can improve circulation in your legs and are intended to prevent the development of blood clots. You will be asked to wear them for a week after surgery, removing them at night and putting them back on first thing in the morning. Your coach may want to wear gloves to help with putting them on. It's important to smooth out all the wrinkles and pull them up over your thighs. During your recovery, it is important to manage your overall health and prevent complications. Smoking can slow healing and can increase your risk of lung issues after surgery. If you have diabetes, make sure you're following your diet and taking your medication if prescribed. If your blood sugar is higher than 180, contact your primary care physician, as elevated blood sugars increase the risk of infection. A healthy diet, including lean protein, whole grains, fresh fruits, and vegetables, will help your body to heal after surgery. To prevent pneumonia, continue to use your incentive spirometer at home 4 or 5 times a day, 10 repetitions each time that you use it. Walking is very important as you recover. Balance rest and activity, planning for short rest periods during the day. Start with frequent walks that are short and increase the distance each day as you gain more strength. If you feel dizzy when you first get up, sit for a few minutes before walking. Limit stairs at first, but you can increase the amount of stair climbing as you feel stronger. When sitting, use chairs that have arms, backs, firm seats. Be cautious of low toilets and low chairs. Limit the amount of time that you sit to 30-45-minute intervals. Sitting for prolonged periods of time will be uncomfortable for you following surgery. To prepare for the ride home, your coach should make sure that the front passenger seat is moved back as far as possible. A plastic bag on the seat can make it easier to turn your body as you get into the car. If you have a long drive home, you may need to stop after about 45 minutes to get out and take a short walk to decrease stiffness. Your surgeon will instruct you about when you are cleared to drive yourself after surgery. When you get home, you may experience a period of time when your pain seems to be worse than it was in the hospital. That can be a normal phase when some of the medications given to you in surgery are wearing off. Try to write down when you take your pain medicine so that you are sure you're following the guidelines. And remember that the short walks every hour or so can actually help you to feel better. Limit your sitting to 30-45 minutes at a time. A sore throat and constipation are normal issues that you may experience and are part of the green zone. There are times when you may need to call your surgeon and report symptoms that are not normal. This is part of the yellow or caution zone. Nausea or vomiting, severe headache, severe pain not relieved by pain medication, or any of these other issues should be reported to your surgeon. We want to do everything that we can to keep you from having to make a trip to an emergency room. Symptoms of infection should be reported right away. Fever over 100 degrees, increasing redness around an incision, foul-smelling drainage are symptoms that should be evaluated. If you have concerns about a blood clot such as calf pain or swelling, redness in the legs, call your surgeon so that they can determine if you need to be scheduled for an ultrasound test that is used to identify blood clots. Sometimes when you have surgery, other medical conditions may need to be addressed. This is part of the yellow caution zone. Please call your primary care doctor if you have concerns about conditions such as diabetes, high blood pressure, asthma or breathing issues, congestive heart failure, atrial fibrillation. It's a general recommendation to check in with your primary care physician after you have had surgery. There are rare occasions when you may need medical attention right away. This is the red zone and requires you to stop and get immediate care. If you experience sudden shortness of breath, chest pain, or localized chest pain when you cough or deep breathe, it is time to call 911 and get the medical attention that you need. This concludes the information in the video. After you complete your therapy and the doctor gives you the green light to go home, your nurse will review the written discharge instructions from your surgeon. When you get home, continue to refer to the patient handbook and your discharge instructions for guidance throughout your recovery. Thank you for choosing to have your surgery at St. Mary's. It was a pleasure caring for you. We hope that you have received compassionate care and that your experience was positive, and best wishes for a successful recovery.